work requirements for Medicaid and SNAP. I'm Jill Horner. This is Comcast Newsmakers. With me is Tam St. She's President Emerita for the Bucks County Women's Advocacy Coalition. Thanks so much for being with us.
My pleasure.
Let's talk a little bit about work requirements for Medicaid and SNAP, but let's first define those programs. There's the Medicaid program, but there's also the SNAP program, two separate programs. SNAP is related to food assistance, or formerly the food stamps program.
Correct. Yes, and Medicaid, of course, is not just for low income. It's also covers care for nursing home. So most people in their lifetime are probably going to have to access Medicaid too. So those are two big programs that are really primary basics for basic needs of people.
And how are these programs funded? Are they funded primarily through the state or the federal government, or both?
SNAP is purely a federal government funded program, and Medicaid is a combination of state and federal. And of course there's Medicaid expansion that pushed the participation up to 130% of the poverty level. So that got a little bigger than it used to be. But both of the programs are being challenged right now to change the basics of them, and part of that basics is that they want to put work requirements in. Now, the Bucks County Women's Advocacy Coalition is for work. We are all about trying to have work. We're trying to break down the barriers to work for women and their families and men. But the work requirements are extra red tape that will cost not just the government more money to implement. As a matter of fact, the Secretary of State in Pennsylvania came out and analyzed what the cost would be to put these work requirements into the bills. And it would cost the state $600 million more money just to put the framework together for it, and then they have to hire about 300 more individuals to staff the program to track all this stuff. That's going to be a huge expense out of the budget that's already very, very, very narrow and very tight. Could
there be cost savings, though, if this was implemented, because there has been concern about fraud when it comes to Medicaid and the SNAP program, those receiving these benefits that aren't necessarily entitled to them?
Most people, 96%, as a matter of fact, of people who go and access SNAP or Medicaid have been working the year before they had to do it. It's called a safety net for a reason. It's to help people when they hit trying times. About 70% of Americans at some point in their life are going to be accessing some of these programs. So putting these extra barriers in place is going to be difficult. I want to note that right now we are in a time when we're looking and trying to change regulations, and we're cutting taxes and cutting bureaucracy for a lot of corporations and wealthier people. And a lot of it's very justified to do. But at the same time, we're putting more regulations and more bureaucracy in for people who are poor, having a hard time. And that's a problem, because it doesn't break down barriers. It builds barriers for people to access these programs. And it'll put a lot more people without health insurance, and it will also take food away from children and families, because matter of fact, I read that it takes 13 pages to re-up to get your SNAP reauthorization, and you have to have documentation that you're working if you're able-bodied. Now, there are a lot of people that are going to be exempt, but you have to prove that you're exempt all the time. So even people with disabilities are going to have a trying time.
And we just have a few seconds left, but if you do have concerns about this, you are encouraging people to reach out to their elected officials.
Absolutely. There's two bills in the House, and in the state legislature, and there's the farm bill at the federal level. Call your legislators. This is very harmful for families and for individuals who are trying to get back on their feet.
Thanks for being with us.
Thank you.
We've been talking with Tam St. I'm Jill Horner.